Hello, my name is Laura Carlson. I'm Director of Growth at Health at Scale, and today I'm talking with Chief Technology Officer and MIT Professor John Guttag, and with Chief Medical Officer Dr. Mohammed Saeed, who's a cardiologist and a faculty member at the University of Michigan. We're here to talk about Health at Scale's data intelligence, a patented technology that Health at Scale has used to build a number of successful products. Data intelligence takes noisy, hard to use administrative and clinical healthcare data from disparate sources and turns it into productive insights. Mohammed, what are the problems that Health at Scale is solving for payers?
Thank you, Laura. Health at Scale has been focused on improving value-based care, and this has been achieved by understanding the clinical context of the patient, the provider, and the clinical settings. Our mission has been to drive healthcare towards a hyper-personalized model. We're able to do this using machine intelligence that takes advantage of increasing volumes of data being collected and improve healthcare delivery and outcomes. When we identify a patient at risk of an adverse medical event, we're able to identify ways to intervene to get those patients the care they need. We're also able to navigate patients towards the best providers at the right time to achieve better outcomes. It's based on a nuanced clinical understanding of each encounter and understanding the patient and understanding how providers have performed on similar patients in the past.
And John, what advances has Health at Scale made that enable it to bring these capabilities to your clients?
Health at Scale's data intelligence is a patented set of technologies that we can use to create a cohesive fabric of data out of a collection of massive disparate data sets. It does four things. First, it stitches together noisy, fragmented data from multiple sources. It then organizes that data around sensible data abstractions, such as patients, providers, and encounters. It then stores the data in a proprietary universal format that's suitable for building analytics. And then, of course, there are a bunch of analytics that sit on top of this that really drive our products and provide values to our customers.
Can you explain to us a bit more about what exactly the infrastructure is doing?
Most of you are familiar with the story of the 6 blind men and the elephant. Each touches a different part of the elephant, and based upon what they're touching, reaches a different conclusion about the animal they're touching. Medical data is a little bit like that. Different providers each see a patient from a different perspective, and they enter accurate but apparently inconsistent data. Our job is to take all of this information, as we would say the 6 reports from the blind men, and synthesize a cohesive description of what the animal, or in this case, the patient, actually is like. This is quite different from existing systems, which do this kind of thing or attempt to do this kind of thing either by manual work or rule-based systems. These systems are slow to run, to develop and maintain, and easily become outdated. In contrast, our data intelligence uses advanced machine learning to synthesize this cohesive view of individuals.
What makes personalization so important, and why is it so difficult?
As a physician, I've learned that no 2 patients are exactly the same. So we've approached this idea of personalization as the best way to improve healthcare delivery and outcomes. As an example, we look at post-acute care delivery where patients are being discharged from the hospital, and we need to try to reduce the chance of hospital readmissions. This requires an understanding of what happens to the patient in the hospital setting, what types of skilled nursing facilities patients may need to go to, what are the right home health care agencies, and who are the right providers for those patients in the outpatient setting to prevent readmissions. And to achieve this across different geographies across the US makes it an even more challenging problem that requires a scalable, intelligent data solution.
John, last question for you. What makes Health at Scale unique?
First, and probably most importantly, we assembled an extraordinary team of the best minds in machine learning and healthcare. Our team is dedicated, highly educated, and deeply committed to the company's mission of simultaneously improving healthcare outcomes and reducing cost. Secondly, and that's kind of the subject of today, we continually invest in our technology platform. From the very beginning, we knew that our success was not going to be based upon marketing or sales. It was going to be based on having the best products sitting on top of the best infrastructure. Finally, we're a very focused company. We're not interested in applying machine learning to finance or agriculture or anything else, nor are we interested in healthcare problems that don't require sophisticated machine intelligence. Keeping our focus has really allowed us to be excellent at what we do.
Thank you, John and Mohammed. To learn more about how Health at Scale uses data intelligence to drive high-value care, visit us at healthatscale.com.